New tonight, Colorado Democrats and Republicans are coming together to try to improve patient access to more affordable medications.
But there is some division on exactly how to do that. Denver 7's Ryan Fish shares the debate happening at the state capitol.
Diagnosed with multiple autoimmune disorders, Bridget Danderos-Surrett knows the uncertainty that comes with prescription drug costs.
Very terrifying. We don't know one day from the next if we're going to be able to afford our medication.
She now works with Colorado families facing those sky-high prices. A federal program called 340B started in the early 90s to help families like that. It allows certain hospitals and clinics serving low-income and uninsured patients to buy prescription drugs at a discount so they can pass on those savings and expand their services. There's bipartisan agreement the program is needed, but also broken.
For patients, it should be savings, but for the hospitals, it's profits.
Senators Barbara Kirkmeyer and Julie Gonzalez, opposite ends of the aisle, but on the same side supporting Senate Bill 124. They say large hospital systems too often abuse 340B's lower costs.
We not only need to know what kind of profits they're making off of these discounted drugs, but the accountability piece. How are we getting that out to underserved communities?
That bill lays out reporting requirements for hospitals on the money they make from those discounted drugs and bans them from using it on things like advertising or lobbying. But hospitals like National Jewish Health say not all are seeing those massive profits.
Transparency is a good thing. There's probably room where everybody can work, particularly if things could be tailored to smaller hospitals, specialty hospitals like ours. But the way it is currently crafted would be nearly impossible for us to meet.
They say drug makers are the problem, making it harder for eligible hospitals to get discounted drugs for patients. Senate Bill 71 would ban drug makers from imposing those restrictions.
All 71 asks is that the pharmaceutical companies honor the law as plainly written.
It also requires hospitals to publicly post the financial benefit they get from 340B discounts. But critics say that doesn't go far enough. It's a debate that goes beyond party lines.
Speaks to how complicated this issue is.
Patient issues are not partisan. This affects everybody.
At the Capitol, Ryan Fish, Denver 7.
And going in depth on efforts to make prescription drugs more affordable in Colorado, a federal judge dismissed a lawsuit last month that challenged the state's power to cap drug cost. The lawsuit came after Colorado's Prescription Drug Affordability Review Board deemed the drug Enbrel unaffordable. Well, pharmaceutical company Amgen makes Enbrel and filed the lawsuit. The judge ruled, though, the company did not have enough proof that the board's move would cause them harm. Colorado, by the way, is now the first state in the nation to put a price cap on any prescription drug.